Hello, my name is Sue Stutzke. I'm a registered nurse and the owner of Nightingale Private Care. For over 15 years now, I've been helping families take care of loved ones at home. As we all know, there's no place like home. If you're watching this, you may have a need in your family. There are many choices in home health agencies, and sometimes it's very confusing as to know why you would choose a particular company. I'd like to tell you a little bit today about why Nightingale is different. First of all, we are not a franchise. We don't use prepackaged plans, prepackaged forms, prepackaged corporate ideas. I waited until I was 40 years old to become a registered nurse. And I have designed my company using registered nurse ideals. And that is, we always want to be a patient advocate. So if you decide to use our services, either I come to the home myself or I send one of my registered nurse case managers. We get to know you. We design a care plan that's specific for your family member. And then that nurse is available 24/7 for you to call if you have any questions. Perhaps you live out of state. You call mom or dad and they just don't sound right on the phone to you. You can call Nightingale, ask for their nursing manager, and she can run over to check on them. Also, these nurse managers exchange emails with you so that at the end of the day, if my nurse manager has been over to see your mother and something's changed, my nurse manager can email you. I saw mom today. She's a little bit different. I want to talk to you about something. Families really enjoy this particular personal contact. This is how we're different. We personalize the caregivers that we send to you. We don't just look at a schedule and send you somebody that's free. I know my patients and I know my employees, and we personally match the right caregiver to your family. We're also different because we are nationally accredited. Not many agencies are. This means that we not only follow the state guidelines, but we also follow more stringent guidelines that allow us the distinction of being nationally accredited. What are some of those differences? We do random drug testing here. We do extensive background checks. The state only requires fingerprinting, but we do an additional background that checks their criminal history throughout the nation. We also check their driving record. So we really know what kind of caregivers are coming in to find employment here. I meet my caregivers. I interview them myself. I hear their names and report twice a week. I see them on payday. So we have an idea of who we're sending into your home. We're a guest in your home, and I know that you want an agency that follows all the guidelines that not only the state recommends, but also these higher recommendations of accreditation. We provide some wonderful services, whether your mother needs someone just to take her to the grocery store, someone to take her to the hairdresser, someone just to remind her to take her meds. Maybe she needs help getting out of bed in the morning, getting her shower. Maybe she's not eating properly and you need someone to help fix breakfast and lunch, and maybe put dinner in the refrigerator. Perhaps your loved one has Alzheimer's or dementia, and they need someone around the clock to make sure that they're safe. You may need a nurse to fill pillboxes and manage their meds. Perhaps mom has gone to the doctor and the medication has changed, and you need a nurse to check on her to see how the new medication is affecting her. These are all the services that we provide, and we have a few fun extra things like if you're going on a cruise and you want to take grandma with or your father or grandpa, we can send a home health aide with so that you can enjoy your cruise and they can go with and you have someone who's skilled that can help them. So we also have nutritionists, and we have occupational speech and physical therapists. Sometimes when a person comes out of rehab, they need a little bit more physical therapy when they get home. These are some of the additional things that Nightingale has. We're also different in that we answer our phone 24 hours a day. If you have a need or your family member has a need, it is no fun to call and get a recording that says, "I'm sorry, we're not answering, it's not office hours." We answer our phones with a person 24 hours a day. This gives you peace of mind whether you live next door to mom and dad or whether you're out of state. And we feel that that really does set us apart. So in closing, we hope that these things will give you some considerations for choosing Nightingale. We're always open for questions. As I say, you can call us anytime. We hope that for you, help is only a phone call away.